Our next session will be a panel discussion. The moderator is Dr. Bertha Serwah. She will be joining us by Zoom. We'll be looking at a few discussions, a few topics: medical career pathways, work-life balance, and managing your studies. Then we'll have questions and answers. Dr. Ayi will be sharing her screen very soon.
All right. Good afternoon, everyone, and thank you for having me. I'm really excited that technology has made this possible. It's interesting that our theme is about how we can leverage technology to promote medical education, and with the power of technology, we are all able to join from wherever we are in the world. I graduated from UGMS in 1996. Currently an infectious disease specialist. I did internal medicine, and I'm happy to be the moderator for this morning's session. And I will also have a presentation to go second. So let me just introduce the three speakers for this morning. Our first speaker is Dr. Kobina Atta Bainson, who is actually in the room with us today. Dr. Kobina Bainson graduated from UGMS in 1985. After his MB-CHB degree, he completed a diploma in dermatology at University of London, a master's in public health at University of Maastricht, and a master's in public administration at the Ghana Institute of Management and Public Administration. At the beginning of his career, he worked as a national program manager for leprosy at the Ghana Health Service in Cape Coast. Later on, he became senior health advisor for Danida at their health office in Accra, chief of party community-based health planning and services program population council, and DFID technical advisor to Ministry of Health. He's now retired and doing all the things he always wanted to do, which he couldn't do while he was actively working. And he will be talking about medical career paths. And as you could tell from his CV, he's in the best position to share the most important practical tips on this topic. Our last speaker is going to be Dr. Irene Appiah, who is a graduate of the University of Ghana Medical School 2018. She practiced as a medical officer in Accra, and while she was in school, she was very active. She served as the vice president of the Debate Society and later as the general secretary of the Federation of Ghana Medical Student Associations. She will be talking about managing your studies while I talk about work-life balance. And so without further ado, please welcome Dr. Kobina Bainson.
My slide, please. Distinguished ladies and gentlemen, it's a pleasure to be here this afternoon. I'm Dr. Kobina Atta Bainson, and I'm going to talk about medical career pathway. Next slide. My outline is I'm going to look at the concept, briefly at the concept, but I'll focus much more on the practical considerations and a few recommendations, particularly for students. Next slide, please. I tried to look at the literature on the definitions of the medical career pathways. But I saw some deficiencies, so I decided to really create my own definitions. Some of the deficiencies I saw was that one was that it is not linked to one's career goals. The other deficiency I also observed was that it's not also linked to your wider goals in life. And three, I thought I found it rather linear. Please, the slide before, please. So there's my definition. I see it as a series of choices made to achieve one's professional goals in relation to other life goals. Well, let me take them one after the other. We have our life goals, different life goals. One would be in terms of recreation, one area would be in terms of profession, the other would be in terms of recreation, profession, and then other goals. Okay, but decision making, it has to do with weighing different options and deciding which one you want to adopt. So that is why I went for this part of the definition, because I think it's all encompassing and it's not linear. But at the end of the day, if you take a cohort of people, some will have a linear path. For example, they might be in Ghana Health Service and then rise through the Ghana Health Service. So that is a linear path. Others will be in Ghana Health Service and probably move to another organization, probably move even internationally. So others may have a convoluted path. Others might also, unfortunately, have their careers prematurely truncated for a number of reasons. Death is one, but sadly, sometimes it has to do with drugs. Other times, it has to do with a crime that they've committed. Recently, I heard about a doctor in the US who had been jailed as well for insurance fraud, and that is very sad. So if the medical students are here, please, I will really entreat you. This course is tough enough. The last thing you want is to get hooked onto drugs and destroy your career forever, or even alcohol. We've lost doctors who through alcoholism. So unfortunately, it's like that. So, but there are three key influences of this pathway. I mean, the choices that we have to make. One is at the level of your discipline. What kind of discipline do you want to study in medicine? The second one has to do with at the institutional level. What kind of institution do you really plan to really have your career in? And the third one could be a locational. Do you want to have it within country or outside? And the third one could be a locational. Do you want to have it within country or outside? Even within the country, there are several options. So for the disciplines, because I don't want to go into, because the time is very short, so I don't want to go in-depth into it. But these are the broad areas: public health, clinical care, training, research and administration. At the institutional level, there's a wide range of them: public sector, private, what we refer to as the quasi-government, the NGO, and even the donors, among the donors. Academia, I mean, some might even decide to go into consultancy, or even politics. It's even wider than this, because some might even decide to go into law, or even into journalism, or even sports. So there's a wide range of institutions where a doctor can practice in. And as I already said, the location pathway, location can also influence this, whether you want to do it locally or internationally. Sometimes the facilities might not be here, so you may be forced to go outside the country to really get the relevant skills. Next slide, please. But I'll quickly go through some of the practical considerations people have to take on board. The first one has to do be self-aware. You should know yourself, your capabilities, both physically and mentally. But also beyond that, you need to look at your broader context, life context. For instance, for one student, the father has a practice. All he has to do is to finish his work and join the father practice. So, and for another, the guy is from a family of 7. He's the first person who's going to university or go to medical school. They're all waiting for him to come and pay school fees of the remaining brothers or sisters. So you need to be aware of your own context, social and economic context, in helping you determine what you want to do within your career. The other important area has to do with values. And for me, this is very, very important. I worked in a mission hospital, but I decided not to continue working there, likely because of values. I'm strictly pro-choice when it comes to reproductive health. And within a mission hospital, there are certain constraints to reproductive health. And for me, it was not in keeping with my values of pro-choice. But another important area has to do with relationships. You need to factor into your career issues of relationship. For example, you want to really have children because they have an effect on you. Personally, whatever job the job I took, there were two considerations I often made. One was I wanted to make sure that any position I took didn't diminish my wife's career. That was very important to me. Then second to me was any position I took, the family should be cohesive. In fact, there are jobs I rejected simply because it would diminish my wife's career. Because I believe that I just imagine that if something happened to me, my wife's financial situation, she would to support the kids. I don't want a situation where I would rise very high, then my wife's career goes down. Suddenly something happens to me, and then I don't know what happens to the kids. For me, it was those two factors were very, very important. And the other important practical consideration is hobbies and volunteers. Sometimes we take these things for granted. But being a voluntary, for working for a voluntary organization, sometimes you build the skills, and it might be the career that eventually you might adopt. For example, I used to work in PPAG, family planning, and I rose through the ranks as a regional chairman and also council member. And I picked out a skill, leadership skills, just in being part of that organization. Others would use that and probably even get international jobs. So we should not take issues, the hobby and voluntary work lightly at all, because that might be what will propel you to the next level. I know of a doctor who was a sports enthusiast. Later, he found himself working with Black Stars as their doctor, and so he used to travel around. So we should not take this lightly at all. The other important practical consideration has to be whether you want to be the public sector or private sector. I think generally, if you want job security, it's good to start with the public sector, really. Private sector, especially if you work with the NGO, can be, I mean, there's a lot of insecurity at the NGO, because NGO, you might look at the NGO, for a 5-year project, suddenly they tell you 4 years there's no money, they stop. It just stops, because what part of your contract is that if this is contingent on funding. Yeah, that's a part of the contract when you work with an NGO. So you need to really examine whether the job security. But also generally, I think that in the public sector, there are better opportunities for trading. So generally, it's better to start from the public sector and later decide whether you want to move on to other areas. Of course, one of the things we need to consider is facilities. If, let's say, you want to be a neurosurgeon and you look in country and you find that the facilities are not adequate, I mean, that may probably be a justification for you to go outside and get the relevant skills. Another very important consideration, which often we don't talk about, is retirement. During retirement, we are most vulnerable at that time. So whatever job you take, you need to look at what will be your financial position during retirement. And that is really very important consideration you need to look at. The next slide, please. Then I have a few recommendations. I think we need to look at, during the early stage in our career, we need to set our goals, clear goals, professional goals, relationship goals, maybe sometimes spirituality. I've known doctors who've abandoned their professional goals and went started establishing their church. So you need to look at all these goals and define your career within those goals. Somebody will be perfectly happy advancing his career without a family. Another person will really want to compromise a bit on the career for the sake of the family. So these are all choices that are not simple. Those are all choices that one has to make. But also the other important consideration is that you should look at your own measure of success. You should determine your own success. We should look at other people's success, because what makes you happy will not necessarily make another person happy. So somebody might be very happy having a huge mansion. Somebody else might be happy just having a small apartment somewhere. So you should define your measure of success. It's also very important to have a mentor. A mentor is somebody who is experienced either in that particular field or generally in life, who can really guide you. You probably test your ideas with a mentor. And sometimes, if you are really lucky, a mentor can just hold your hand and walk you through the job. So it's very important that, especially you look for a mentor in any stage of your career. And as I've already highlighted, we should really work hard to avoid drugs, alcohol, and crime. One set of skills that I will always encourage people to build, whichever career you take, these 3 skills: research, writing, and public speaking. Research gives you a better understanding of the problem at hand, and then writing will help you to communicate it. Writing and public speaking will help you to communicate those. If you have information and you cannot adequately communicate it, it's of no use at all to anybody. So I will encourage those house jobs during the house job period. That's the time we should do some exploratory work as to what we want to do. You may decide to go to the Ghana College, learn about the program they have there, probably go to some of the agencies in the Ministry of Health, do some exploratory work during the house job period. Because once you move into a district, you may not have the facilities that are in Accra. So the house job period, for me, appears to be the best time to really do this exploratory work. And I would really encourage the medical school to really get this topic in shape, because I think it's very important. we should really institutionalize this topic. Thank you very much for your attention.
All right, thank you so much, Dr. Bainson. That was very, very nice. And can you all see my screen? Yes, so interestingly, his topic sort of merges with mine a little bit, and I'll try and be brief. It's 18 minutes past the hour. And so I was asked to address work-life balance, and I think Dr. Bainson mentioned a good proportion of what I was going to say. This weekend, I happened to be making rounds with another female doctor looking at homes, and she made a very interesting comment, which I think applies. You know, I asked her how she was doing. This doctor is an infectious disease specialist like me, and as a side hustle, she's trained to be a realtor, meaning she sells homes. She just got her license, and we were looking at different houses, and this is what she said to me. She said, you know, as for the work, it's easy. You know, I know exactly what I'm doing. It's the other part that is hard. It's the life. That's what we don't understand much. So as I'm assuming I'm addressing medical students and maybe young physicians, because you've gone to medical school, you have a whole host of people, lecturers, supporters who are designed to help you succeed as a doctor. I mean, there's very little you can do not to be successful. You know, you are skilled, you are trained, and if life was just about being a doctor, that would be very, very simple. It's easy. It is the other part. Life, taking care of yourself, having time to nurture your spirit, having time to nurture your soul, and taking care of your body, exercise, eating right, your mental health, that you don't burn out. That is the part that becomes a challenge. And then, like Dr. Bainson was saying, making sure, he wanted to make sure that wherever he was, his wife was also there. So courtship, marriage, children, family, friends. Nobody trains you for this. In fact, you have sometimes very successful physicians who are having a terrible time with their marriage, or they can't make any social impact. But if you take care of yourself first, you will be able to be relevant to your family, you will be relevant to your friends, and then you can think about making community impact, social impact, and global impact. So there comes this idea of work-life balance. It's been defined as the state of equilibrium where a person equally prioritizes the demands of their career and then the demands of the personal life. And some of the reasons why the work-life balance can be off is increased responsibilities at work, longer working hours, increased responsibilities at home, and having children. And maybe because I'm a woman, I can give the perspective as a woman. I mean, I look at a lot of male physicians, they can decide that their wives are stay-at-home mothers, or maybe their wives are going to be working. But as a woman, you have your career to balance, and then everybody expects you to still act as a mother. You are still a mother, you are still a wife, you are still everything everybody expects you to be. So that can be a challenge, and nobody trains you for that. And I think that's why my friend was saying that as for the work, it's easy, it's all the other things. Nobody trains you for that. And so you have to find a way of learning how to do it and balancing the act very well. And one of the things that I found very practical, so you don't lose yourself in the job, because you can, I mean, once you become a doctor, everybody wants to ask you a question. Everybody wants you for something. People have many, many needs, and you know so much, and to whom much is given, much is required, of course. So should you spend all your life working? I had a friend who went into the rural areas to work, and he said he would work from 6 a.m. to 10 p.m. doing surgeries and seeing patients, and people will still complain that they haven't been seen. So you can spend all your life spending your life away. So the first thing is you need to get in touch with yourself. Who are you? What are your hobbies? Who were you before you decided to study medicine? And personally, I find that the more you study, you realize that you're probably using only just about 5% of your brain to do medicine. I mean, after you get used to your career, it's very, very easy to do. There's so much more to you. Maybe you could sing, maybe you're a good speaker, maybe you used to play the guitar, or you love making beads or baskets or whatever it is that you want to do. Your altitude, I realize, in life will be determined by how you leverage your own personality and your networks to become completely fulfilled. At the end of the day, you want to ask yourself, am I a happy person? Have I become a doctor and become miserable? I know several physicians here in the US, about 400 physicians commit suicide every year. So it's not about, and some of them are really, really good physicians. It's not about their career. It was all the other things they couldn't manage. So you have to be in tune with yourself and try to be whatever that makes you, try to fulfill those things that make you happy. And whether you like it or not, technology has come to stay. I know some physicians who retired prematurely because there was the evolution of electronic medical records. They were not willing to learn. And if you're not willing to learn technology, you would become extinct. I read about Cicely Tyson. She's a well-known actress who died, I believe, last year at the age of 90. She said at some point she got a job as a secretary, and she looked at herself and she thought, you know what? I don't want to be typing all the days of my life. You know, those were the days of the old typewriter. And so she decided to pursue her interests. And for a while, her mother would not even talk to her. She just refused because she didn't want to be a typist and wanted to go into acting. But in the end, she became one of the world's famous actresses. I think of Oprah Winfrey, LeBron James. The bottom line is, find what makes you happy and do it. And even in the profession, as you go through medical school, you would find that you lean towards certain areas. Maybe you were born to be a surgeon and you go into internal medicine and it doesn't make you happy, or dermatology, or whatever you find yourself doing. Be ready to switch if what you're doing, if you don't love what you do, you go to work miserable and you're never going to be happy. So you need to do what you love, find the perfect balance, prioritize your health, and take a vacation if you have to, take a break. Make time for your family, set boundaries, set goals, and finish your work at work. And I can't emphasize the last part enough. I happen to be friends with the wives of a few physicians, and they complain about how their husbands bring loads of charts to complete at home. They don't finish the work at work. They come home and they're still working 10 p.m. into the night. So really, they're just in the house. They are not relating to their wives and families because they're bringing their work to the house. So it's important to finish your work at work. We may take other questions, but we promise to do just short 5-minute presentations so that people can ask questions. So I will end my presentation at this point with the conclusion that, yes, you can live a very fulfilled life as a physician. It's not just about the work that you do. We are trained very well for work. It's all the other stuff that becomes a little difficult. And it takes a fine balancing act to do it such that you are living a fully happy life and also being able to contribute to society and being relevant to your family. Thank you so much. Our next speaker is Dr. Irene Appiah, and she's going to be talking about managing studies.
Hello.
Hello. Please, I think Dr. Irene Appiah is having some technical challenges to which she has been communicating with us. I do not know what the moderator of the session would do, but okay, we'll try.
Yeah, the topic is on studies. Apparently, some medical students are having difficulty with their studies. All of us had difficulty. I mean, this course, honestly, is tough enough. Really, I'm not even sure whether those who got distinction had it easy. Everybody had it tough, but perhaps I will just give you a few hints. Those who are here, I'll give a few hints on how some of us managed to survive. We only survived. We only survived. Yeah. I'm speaking for myself. The first one has to do with sometimes I think our lecturers drop hints. Our lecturers drop hints that we don't really observe those things. For example, I mean, Prof. Atta used to tell us that before exams, just take it cool. Make sure you work very hard long before the exam. But before the exam, just take it cool. That's what I did. I just obeyed him. So I would work very hard before the exam. 2 weeks to the exam, I just read novels. That's all that I did. About 2 weeks to the exam, I just took it cool. And for me, it helped me because I wouldn't touch a book. I would just quickly refresh the day before. But generally, I would read novels. So the other one has to do with the multiple choice questions. I remember when we came first. They advised us, please, if you don't know, don't shade. They said repeatedly. Some of us ignored it. In fact, what really struck me, the very first one that struck me was one of them. I remember very well, Serwah Mante. The guy, he answered 53 questions. He got only one wrong, and he got 51%. I said, hey, those of us, we shaded 75, and we are 30%. So they drop hints. The lecturers drop hints along the line, but somehow we don't see it. The other one has to do with the learning itself. It's a lot of work, no doubt about that. And you have to find different ways of remembering some of the stuff. For example, microbiology, those names, you have to remember them. There's no other way you can run away from that. What I did was, we used to have group discussions. We used to have group discussions where we interacted on this. That helps to remember. But personally, I prefer the one-on-one. Because I realized that the more I taught, the more I learned. So I had a colleague, my next door neighbor. Anytime I learned something, I just sat with him. I taught him what I learned the day before, and also he taught me. So the one who was teaching actually learns better. So for me, that was the technique I used. The other one has to do with, I think sometimes has to do with the exam questions themselves. The exam questions, sometimes we don't take diligence in really reading the exam questions. I remember there was one, but luckily it wasn't a major exam, it was maybe one of the class exams. The issue had to do with discuss. So the discuss had to be pros and cons. Then I just wrote the pros, I didn't write the cons. So sometimes it has to do with really critically looking at exam questions, trying to understand what the examiner wants, and answering it appropriately. So for me, that is one thing. The other one, these are some of the things I jotted down. Let me see whether I remember anymore. So the group discussions, the group discussions, the personal discussions, really help you to retain some of the stuff. And I'm sure other people can add something. This one has to do with what do you do? How do you make sure they don't become a casualty in the medical school? Thankfully, I didn't become a casualty. I didn't get a decision, but I didn't become a casualty. So that's how I did it. Thank you very much.
All right. Thank you, Dr. Bainson, for stepping in. I think Dr. Irene Appiah had a problem with her internet. I'm hoping she'll be able to rejoin. But we're about 5 minutes past the time that was allotted to us. That's partly because we also started a little late. So we'll take questions at this point, maybe for another 5 minutes or so, and then we can adjourn.
Thank you very much. I'm in my final year now, and my final year now. And for some of us, and for some of my colleagues, there's the impending question. So when you're done with your house, what are you thinking of specializing in? We haven't even started the house job, we haven't even written our exams, but we get these questions, sometimes from within ourselves, sometimes from our friends and their family. And quite a number of us still don't know what we are more inclined to do. And I know I've asked some people and they said they figured it out along the way, but is there an easier way to figure it out than along the way?
Let me use my own example. The moment we did dermatology, I knew that was my passion. I knew I was like, the moment we did dermatology, but then that fed me. You understand? How did it happen? So my mind was to do dermatology. So then I joined the leprosy service. I heard that I was informed that the leprosy. So I got there. I did the dermatology. Oh, okay. Oh, sorry. Oh, it's better I come here. Yes. So I went to leprosy service to do dermatology. So then there was a vacancy. There was going to be a national program manager position vacant. So I had to do public health in addition. Otherwise, I couldn't take up that position as a national program manager. So here I've done dermatology, I have public health. But much of my life, it was the public health that propelled me along. So initially, it's not always easy. That one granted. And as I've said, a lot of factors might come in your way. Sometimes that you don't even expect. But what you need to do before you leave Kolebu is to do the exploratory work. Yes, I mentioned earlier, life is not linear. It can be convoluted. And you can't always predict how things would. I mean, look at what is happening in Ukraine. Did you ever expect this? But please, don't leave Kolebu without doing some exploratory work. Thank you.
And I think to add to that, I would add that and Dr. Akafo is here, one of the most powerful words that anybody said to me was, I remember doing my ophthalmology rotation and asking Dr. Akafo what I should do. And he said, Serwah, whatever you do, I think you'll be successful. It was a very powerful thing, and I've carried it with me for over 20 years. But I think that for the student who asked the question, you should ask yourself, are you more of a hands-on person, or are you somebody who just likes to think a lot? Because the surgical specialties involve a lot of, handiwork, cutting. Well, internal medicine, psychiatry involves a lot of thinking. I know some people who've chosen internal medicine, psychiatry, the specialties where it's a lot more brain work than handiwork, and they're very frustrated because there are people who want to do things all the time. So for example, outside of medicine, there are some personalities, like the melancholy personality, who make very, very good accountants. If somebody who has a choleric or outgoing personality becomes an accountant, they'll just get frustrated because the sitting and the numbers will frustrate you. So in a way, it's also about knowing yourself and also where you want to practice. So not to bring financial perspectives into it, if you come to maybe UK or the US, you would realize that if you're a surgeon, you might be making 5 or 6 times more than somebody who did internal medicine or psychiatry. So you would find some people going into those specialties because of financial remuneration. Or somebody might be a radiologist because, look, in the terms of work-life balance, they would rather read a few images and just go home. So like Dr. Bainson said, it involves a lot of thinking. And also, maybe, I don't know if we're doing it in the medical school now, like you said, I think we should assign mentors or counselors to, nobody really counsels you, like you said, go figure it out. And as we inaugurate our alumni association, maybe that's something that we should seriously look at. Maybe even setting up an office of a counselor, somebody who directs students based on the 4 years of knowing them, what they should do with their careers and how they can manage it going forward.
Thank you very much. I also have a question. My name is Rafaela Ejako, and I'm also in final year. You said that during the house job period, it's a good time to do exploratory work. And earlier on, we had a session with one of the doctors, and he was saying that he did his master's in physiology during the house job period. And I was wondering, because a very rigorous one, the house period is a very rigorous run, and you don't know, how your schedule will be like, how your weekends will be like. You factor programs such as doing your master's, doing your...
I'm assuming Dr. Bainson is going to take that one.
Yeah, I'll
Yes.
just quickly.
Yeah.
Look, I fully agree with you. House job is very demanding. In fact, for my time, I mean, 6 months we have not even got salary. So how do I eat? I had to, thankfully, Rapito, and I went and did some locum there. That's how I survived the 6. So it's not a joke. But to be honest with you, if you move out of here to go to a district level without finding time to do that, you won't have the time. You will not have the time. I'm not kidding. You will not have the time. Try and find time, because you need to start interviewing, talk with different people to really get a sense of what the department, what the work involves, and you have to do that. I fully agree with you. House job is tough, and even the first 6 months, I don't know what has changed. Do you guys? Yeah, in our time, 6 months. Let's go and do locum before you can even eat. And I'm going to
Thank you very much. I want to just add something, that the Medical and Dental Council is very strict and firm. House job is a full-time activity. You cannot do house job and do a secondary MPH or physiology. That is not allowed. If they get to know, you'll be stripped of your house job, and you cannot do that. So that should not be something that you should be thinking about. Otherwise, you finish, you become jack of all trades, master of none. The house job is there for you to acquire all the skills you need. Take your time, finish it, and then decide what you want to do next. So I just wanted to make this. So now they are very firm and strict. So you should wait and do it after. And also with locum. Until you are registered on their register after house job, you have no business engaging in locum. You practice it illegally, and the consequence may not be pleasant. Thank you very much.
I believe believe Dr. Irene Appiah, who was supposed to speak, has a comment to make. Dr. Appiah wants to make a comment. She was the one who was supposed to give the last lecture and did not quite make it. Irene, Dr. Appiah, please go ahead.
All right, thank you. I'm so sorry about all the interactions. So with regard to your question, I think the easiest thing you can do, especially now that we've been reminded that you can't do a secondary MTH and document and all that, is to talk to as many professionals as you can. I think that in our field, a lot of us are stuck with the idea that you do your house job and then you pick a specialty. And most of the time when we say pick a specialty, we're referring to a clinical specialty. But like the first speaker said, there are lots of things that you can do. Public health is a very broad area. You can become a researcher at all. Throughout my medical, have any experience understanding that a doctor could decide that their role was to become a researcher. So the best thing you can do in terms of trying to find your footing is, one, don't panic. Honestly, things will happen as you sort of go ahead. I finished my house job last year, and for the longest time, I was still toying with a whole lot of ideas. And so, honestly, even if when you're done with house job, don't necessarily think that by the end of house job, for sure, you know what you want to do. All I'm saying is give time. But as you are giving the time to unfold, talk to as many people as you can. Talk to epidemiologists, and a lot of the doctors do other things. So somebody is working at the infectious disease unit and he's an epidemiologist. If you get the chance, talk to these people. People are hematologists and they are lecturing, you see, because a doctor can also decide that they want to become an academician. So talk to as many people as you can, make notes, keep these contacts, and as you go, things will become clearer. Thank you.
Thank you, Dr. Appiah.
Let me just add voice. Say that there really is no hurry. Pick it up. There really is no hurry. I think everybody believes that by the time you finish medical or job, you should know the specialty you're getting into. If you finish house job and you're undecided, just follow on, get a job. That job might lead you to your final destination. But I just want to say that maybe in medicine, we're not behaving as the whole world is behaving now. You can start off as a pathologist, but end as a medical journalist. I think people should be fluid. It's not a one track. You're a surgeon, and therefore you're a surgeon to when? I mean, till you drop dead? I don't know. I mean, you know, once you do your first appendectomy, the second, third, fourth, what's the difference? Really? You understand? So I think that there should be no rush. Some of us were lucky. I mean, I wanted to do internal medicine. And again, it's important that you know yourself. If you know yourself and the kind of person you are, you know, there was no way, even as a house officer. I mean, people insisted that I did appendectomy or did a breast lumpectomy. I said, no, I won't do it. Because I didn't want to be a surgeon. I wanted to be a physician. But final year, I changed my mind. I wanted to be a pathologist, and that's it. So I was fortunate, and I met somebody who changed my mind. But the fact of the matter is that there should be no hurry. Get into the practice of medicine, and you know, you would gradually find your own field. And be prepared. You know, a lot of people do multiple things. You're a practicing doctor, but you like writing. So you write, and you share your experience. All right? So medical journalism becomes different. You're a researcher. everything that you're doing, you are putting data together and making sure that you mine your data and, write on the data. There's so many things that you can do. But it's almost as if everybody believes that by the time I finish house job, I should have made up my mind. I want to be a surgeon, I want to be a rheumatologist, life is not like that. Thank you.
All right, Professor Kosa, that was a professorial deep answer. Thank you so much for sharing that insight. That was Professor Bedu Akosa. Thank you. That was good. You don't have to know it all and be ready. You might even end up as a politician or a building constructor. Who knows? All right. Are there any other questions?
Thank you again, Frank Ayugani final year. I think of the system of medical education in the US, in that you do your pre-med, a bachelor's in I think a science-related course, and then afterwards you apply to a medical school to do medicine. And for most, or for some of those who come here for research, electives or exchanges, they are usually done with that pre-med, and then they come here just to experience some research or explore an area. And then when they are satisfied with that, or when they've had a breather, sort of, then they continue to the medical school. I think it's not as fluid as it is here at this day. I want to find out, in most of your experience and in most of your classes, were there cases where people deferred after something level 300, where they've had a BSc Medical Sciences, do something with their life, and then come back to continue with their 3 years?
I would allow everybody else to chip in, but I'll share with you that I know people who went into the US military and went back to medical school at the age of 32 or 33. I worked with one. When I was in my residency, I was working with a 50-year-old woman who had worked as a case manager or social worker all her life and finally decided, you know what, I want to do medicine, and went to medical school. So if you're getting tired of all these studies and you want to explore, look, it's your life. You are unique. You are 1 in a billion. You don't have to do what everybody is doing. I don't know if, of course, the limiting factor will be the policy in the medical school and whether it allows somebody who has finished their basic sciences and gone to do other things to come back, and I don't know the policy, but if there's no such policy restricting you and you want to explore, you can make your life as unique as you want it to be. So that's just my comment. I think anyone else can give a perspective. All right, well, in the absence of any further questions, I want to thank you all for giving me the opportunity to moderate this event. I learned a lot myself, and I want to thank Dr. Akafu for making the virtual component of it possible. I thank Dr. Bainson for taking time to prepare, and I want to thank Dr. Irene Appiah for all the effort he put in it. Although we couldn't hear her much, she was still a vital part of this. So I think we'll bring this session to a close, and thank you all so much. And I wish all the medical students the best in their careers.
Thank you all very much, and thank you, Dr. Aye, for moderating this very beautifully. Now, we're supposed to be on break now, 2:30 to 3. It's just 6 minutes. I think we've been given something. Let's give ourselves some 5 minutes to stretch a bit. If we want to dip our hands into the packs in front of us, let's feel free. And then we'll reassemble, let's say 10 minutes. We'll reassemble in 10 minutes for this next session. Please, it's not licensed to go away. Please come back.